Hi, I'm Dr. Nandini Nelivigi, a senior consultant orthodontist, director Nelivigi Dental Clinic, Bellandur, Bangalore. Today we'll talk about tooth whitening. Now there could be basically reasons why somebody is asking for tooth whitening. They feel that their teeth have turned yellow, they don't look very good when they smile. That's how one would ask for tooth whitening. Now stains on the teeth can be due to two reasons. One are called intrinsic staining and the other one is called extrinsic stains. Now intrinsic staining means the stain happens from within the tooth. Why does this happen? There can be quite a few reasons why this happens. Like say for example, taking some medicines like tetracycline or minocycline can also stain your teeth, or using mouthwashes like say chlorhexidine mouthwashes for a very long period of time every day can also stain your teeth. Things like tooth decay can stain your tooth, or if you've had a trauma, the tooth can change its color. So these are intrinsic stains which do not go with a regular procedure of polishing and cleaning your teeth, or scaling, what we call them. So this does not remove these intrinsic stains. The extrinsic stains are formed because of some deposits happening on the tooth surface. Like say you have a lot of dental plaque, you have a lot of dental calculus deposits, you're taking a lot of tobacco, like say smoking, or you're taking a lot of caffeine intakes, like say drinking a lot of coffee through the day and not rinsing your mouth, drinking a lot of red wine. These things can cause extrinsic stains on the teeth, which can be removed with just a round of scaling and good polishing. So now when it comes to intrinsic stains, how can they be removed? Yes, they can be removed with bleaching. Now what does bleaching do? What is it chemically actually? Bleaching involves a chemical substance called carbamide peroxide in a ratio of approximately about 10 to 44%, or hydrogen peroxide in a ratio of about 3 to 16%. Now whenever this hydrogen peroxide is applied on the tooth surface, it penetrates and goes into your enamel surface, and it becomes free radicals. These free radicals bind with whatever is the coloring agent present within the tooth surface, and it lightens up them and dehydrates the tooth. So basically when you dehydrate something, it gives a chalky appearance, right? In the same way, the tooth also appears much more chalkier or whiter as you get this kind of bleaching done. But bleaching is not a permanent solution. The tooth over a period of time will again get rehydrated and it will start appearing the same, depending on your kind of food intake. So you can hold on to that whitened color of your tooth for a longer time if you are very cautious of what you eat and drink. But if you continue to drink caffeine stuff or red wine or things like that, yes, you can regain back the color much quickly. But usually a span of say 6 months to a year should be a good time for you to again probably think of another round of bleaching. But there are quite a few side effects of bleaching, two major of them. One of them is called sensitivity. As it dehydrates the tooth and a small portion surface enamel is lost, sensitivity becomes a major issue in almost 70 to 80% of the patients. So getting a bleaching done would be something that I would recommend only if it is an absolute mandatory procedure, like say before a wedding or something like that. But generally just getting a bleaching done every time, like how you get scaling done to clean your teeth, would not be something that I would recommend of. As the tooth dehydrates, it becomes sensitive, and then the sensitivity may take close to about 3 to 4 weeks to completely settle down. So if you are weighing it to be more useful to get bleaching done, like say a photo shoot happening for whatever reason, that you are getting married or something, yes, we can do bleaching, but not otherwise. There are two kinds of bleaching that can be done. One is called a home bleach, the other one is called an office bleach. In home bleach, the kit itself carries a material which when put in hot water and put against your tooth can be molded into the shape of your tooth. Then you apply the bleaching agent onto the tray and then place it in your mouth as recommended by the company, and you can use that to bleach your tooth. It should reduce the tooth shade by about 1 or 2 grades. An office bleach is something wherein the dentist will apply the bleaching agent onto the tooth. Before that, they will cover the gum area so that the bleaching agent does not touch your gums. These bleaching agents, as I said, are caustic, so they can cause some kind of burn injuries on the gums as also. So they cover the gum area with some kind of gel, and then a tray is formed, and then the bleaching product is put onto the tray and placed against your tooth for approximately about maybe 10 to 15 minutes, and then it is washed thoroughly. This may have to be redone 2 or 3 times. There are some light activated bleaching agents also available, wherein the tray will be placed and a light will be projected so that it gets activated and bleaches your tooth. So this is how the bleaching process is done. A word of caution, yes, there will be a lot of sensitivity. You should be prepared to go through a process of sensitivity for some period of time if you are really looking at bleaching. But think before you get it done and weigh the pros and cons of sensitivity as against why you are getting a bleaching process done. And only if you really feel that bleaching is an absolute necessity, it would be recommended, not otherwise. Thank you so much.